Dear colleague, I wish to present to you a clinical case of an adnexal mass. We are dealing with a 50-year-old patient who is regularly menstruating, coming in for a routine checkup with no noteworthy symptoms. On abdominal pelvic examination, we can clearly see that both adnexa are completely and utterly disorganized. In fact, it is not possible to observe the normal differentiation or the typical appearance of the ovaries. Here in the image, you are seeing the right ovary, but a very similar appearance is found on the opposite side. So this is a case of a bilateral adnexal mass, in which most likely within a structure with a solid appearance, there are some transonic cystic areas and a modest vascularization. The uterus appears normal with no significant alterations either in the endometrial appearance or in the overall uterine echo structure. Here you see the right ovary, which, as mentioned, is enlarged in volume, occupying almost the entire pelvis. Within its context, at a threshold area, there are associated multilocular cystic areas, and this aspect is certainly more evident in the examination we are about to perform transvaginally. Upon probe insertion, we observe a normal uterus with signs of a caesarean section and a small retrouterine fluid collection in the Douglas pouch. A similar fluid collection, though small, is also found anterior to the uterus. There is no ascites in other abdominal recesses, such as in Morrison's pouch. And you can see how the ovary, this is the left ovary, is enlarged, has a solid, compact appearance with these vascular strands crossing the mass, which, as you will see later, show low resistance blood flow. So according to the established IOTA classification system, we can confidently assign it a color score of precisely 3. We observe a remarkably similar appearance in the other adnexa, specifically on the right side, where the distinct presence of these multilocular anechoic areas located within a solid mass is even more clearly and strikingly evident. The obviously bilateral appearance, the significant finding of 2 bilateral masses with this small yet present effusion, is of course highly suggestive of a bilateral ovarian pathology, much more likely of stromal rather than epithelial origin, but this type of definitive diagnosis is obviously entrusted to the final comprehensive histological examination. It is critically important in these particular patients to carry out proper and comprehensive staging, which invariably includes thoroughly studying the entire gastrointestinal tract with both colonoscopy and gastroscopy, as well as utilizing other routine radiological methods. But above all, it is absolutely essential to make the patient fully understand the crucial necessity of a multidisciplinary diagnostic approach within a specialized center specifically dedicated to adnexopathology. The particularity here is that the patient, let's say about a full year earlier, had undergone a comprehensive routine medical checkup in which her ovaries appeared perfectly normal and entirely healthy. And this, of course, significantly fits into the complex history of ovarian cancer, which is, let's say, a malignant tumor that grows relatively quickly and aggressively compared to other conditions often found in the female genital area. But here and in the following images, you'll see how the ovarian masses, the ovaries, are extremely enlarged. And in the next images, you'll see how in a single image, you can actually see the uterus in the center with the 2 ovarian masses, which, let's say, move from their normal position more towards the Douglas pouch, and so they look quite similar to each other. Here you can still see at the top the small parotid fluid collection I mentioned earlier, along with the small fluid collection in the Douglas pouch. An extensive assessment in the same general area of the upper abdomen, so a comprehensive evaluation of the liver, the spleen, and other vital structures that can be thoroughly explored by ultrasound imaging turned out to be completely negative. And obviously, this is certainly an extremely important and crucial factor to also take into careful consideration. The characteristic of bilaterality, of course, is highly suggestive of a malignant neoplasm as opposed to more benign borderline forms. Here you can clearly see the 2 enlarged ovaries with a heterogeneous appearance, compared, for example, as we mentioned, to borderline tumors, where in addition to having a different ultrasound appearance, the localization is usually unilateral.